Hi there, and welcome to Let's Talk About Health. I'm Dr. Madeline Mant, and today we're going to be speaking to Dr. Paul Hackett, who is here to tell us about the life and times of a health geographer. So welcome, Paul. Thank you so much for being here today.
Well, thank you very much for having me, Maddie.
Absolutely. Now, Paul, what is a health geographer? What is your job? What do you do all day?
There's very complex questions, but the first thing is that a health geographer can be, there's a wide range of job descriptions for health geographers. I'm probably quite atypical in that, because I tend to focus on the history of Indigenous health. Geography is always there. Geography and spatial aspects of health are always underlying the questions I ask. But you might, and I have been confused for being a medical anthropologist or health anthropologist in the past, a historian, what have you. Health geographer is difficult to define. People use GIS obviously to understand spatial aspects of health or healthcare. But I think the one thing is that we're interested in space and place, and we're interested in how that may be affected by health or how health affects that. So that sets us apart a little bit from a medical or health anthropologist, let's say.
So how did you get into being one? I'm fascinated by this. The idea that you're somewhat atypical, could maybe be confused for other things, but how did you find your way into this career?
Happenstance, I guess, would be the serendipity, and I love it. But it was never planned from the start. I started out as more of a cultural geography, a geographer. Pardon me. I was interested in the history of the church and how that affected urban planning and the urban morphology in Canadian cities. And then when I got to my pre-masters, I learned that in over the course of a few hundred years, millions of Indigenous people across North America and across the Americas died of diseases such as measles. And I'd had measles when I was a kid.
Oh, wow.
And it never occurred to me, this is very early on, this is in, well, very early on, the 1980s, late 80s, probably about 88. I suddenly was exposed, if you will, to the fact that what we're calling virgin soil disease, but introduced diseases, were a key factor in the deaths of millions, if not hundreds of millions of people in the Americas. But they were diseases that I'd had. You know,
Right.
I'm old enough that I'm pre-measles vaccine, and I'm old enough pre-chicken pox and a lot of different things, but I'm also not that old that I would be exposed to smallpox. I had a smallpox vaccination. So my relationship with these diseases was quite different. So I was learning about the fact that things that were benign, relatively benign to me, but not totally benign, that because of circumstances didn't affect me very much,
Right.
had horrible, disastrous consequences for Indigenous populations and societies across the Americas. And I wanted to learn more about that. So that's where the sort of my first exposure to the history of Indigenous health was. As a geographer, I studied the diffusion or spread of disease. So I'm looking at those epidemics, and we're in the midst of a pandemic, and I'm curious about the spread of that pandemic as much as I am of its effects. But same thing for smallpox epidemics, for influenza epidemics, for measles epidemics. I want to know how they spread between people and what aspects of their social structure made them more or less likely to spread between these societies. And so I think that kind of fits with anthropology in a way, because we're concerned with how they organize or structure their lives, what activities they do, what their seasonal cycle is like, and how they may potentially be exposed to other people. Because other people mean disease to me. You know, we're in an era where everyone is a potential vector for disease. But how other groups, other societies might interact with them, and that leads to diffusion. And the diffusion could be at the personal, the family scale, but it could also be at the global scale. And that's another fascinating aspect of it that related to my background as a geographer. Scale is important. So what happens at the sort of local scale can be replicated at larger and larger scales up to the global, or it can counteract each other in some ways. So anyway, that's I got into that, but more recently, after I finished my PhD, I started to look more at tuberculosis, or a more chronic infectious disease, which has different relationship with society. And part of that is that tuberculosis is a disease of a dysfunctional society. Widespread TB in a community indicates something is wrong with it, and that isn't necessarily the presence of the bacteria. It's the social issues that underlie that. So that's again coming back to anthropology, is how culture changes over time through enforced culture change, and therefore through colonialism, can have an impact on the development of TB, lead to epidemics of tuberculosis, as it did in the 1800s in the prairies.
Yeah.
And so I was fascinated by that, and that's where I moved into that. And more recently, I moved into diabetes, which is explicitly a response as an epidemic to cultural change, to colonization. Because as people's lives change, as they change their food, their diet, their lifestyle, so that they're no longer as active, obesity becomes more common.
Yeah.
Other kinds of chronic conditions become more common, but diabetes is one of those long-term conditions that suddenly emerges in populations where it never existed. And the fascinating thing for me was that I'm again an older dude, born in the early '60s, the very early '60s, baby boomer, and this had happened during my lifetime. So something that's occurring I was born in Manitoba, raised for the first 10 years of my life in Manitoba, that was emerging as I was a youngster and I'd never heard about until much later on, intrigued me. Sort of a hidden epidemic that was emerging. So I was fascinated by that. So that's one of my more recent kind of emphases in my research. And in my teaching as well, because we tend to, you tend to take your research and use it as an example for your teaching.
Yeah, that's exactly what I was hoping to get. That's really fascinating. And I really appreciate both you and other folks in the interview series have brought in some of that personal and the professional. I think that's really important to get a sense of how do you follow up on this sort of general interest in health, and it's following a lot of these threads. But you've given us some hints about being at least liking anthropology or being mistaken for an anthropologist, which I think is a good thing. I think everybody should be mistaken for an anthropologist. But how are you engaging with some of those sort of anthropological uses of terms like the word health and illness and sickness and wellness? How do those words weave through your work?
That's a really good question, or set of questions. And to me, the idea of health is one that there is no set definition of health. And I know we use the World Health Organization definition sometimes, or there are other definitions. Mm-hmm. And I tend to focus on the ability of people and societies to rebound from insults. Right. Or in some cases, because I'm working in more and more in aging research, for people to age well. And we know, and I know as I get older, that we're not going to be free of all disease. So health is not about being free of all pain and sickness and insults and what have you, but it's about being able to cope with those adequately. Right. Or to be able to rebound them. And where that gets us into interesting venues, if you will, is when we start thinking about the social determinants of health and class differences and race differences, right. As we're seeing in COVID-19, between people and their capacity to rebound from these kinds of things or to avoid them in the first place. So health can be something related to your job and your ability to not have to go into work, as I'm obviously not in my office right now. Or it can be something whereby I'm in a better condition than other people. So health is, to me, is a very holistic thing. Yeah. But it's flexible enough that we can use it to sort of look at it in any circumstance. So I don't tend to focus on a particular definition of health, okay, but I try to be informed by other definitions. For sickness, I think my minor in my PhD was anthropology. And one of the things I learned was that sickness is basically a term that is defined by the culture. That something that is a sickness may not be a sickness in another culture. So we may focus on something, and then that might be obesity, or it might be something else, or even how we define schistosomiasis within right. a society, and what it is, and may be quite different from another society. So I'm fascinated by that as well. So again, looking at those things, how is tuberculosis different in 17th or 18th century indigenous population, mm-hmm. versus the same population in the 20th century. And during the 1700s and into the 1800s, you get fur traders saying scrofula, but also phthisis or
Right.
pulmonary forms of tuberculosis are quite common, and people just sort of go about their business with them, right? It's, in other words, it's more of um, a common thing and an annoyance than it
Right.
is something that we're going to isolate you and put you in a sanatorium and make sure that you have no contact with everybody.
Right.
By the time we get to the late 1800s and into the 20th century, it's people are being pathologized,
Yeah.
societies are being pathologized. So we've rewritten what tuberculosis means. Still, it's here in the 1700s, it's here in the 1900s, but has quite different meaning about what in a given population. And that relates to cultural change, but it also relates to colonization and those kinds of things. And I think anthropology grounds me in that, and I think anthropology informs me greatly in that. So we look at some of the people I've worked with and some people I admire, and an Anne Herring or a Paul Farmer or someone like that, who come from a different perspective. And I don't mean not just anthropology, but like from all over. And I'm drawing on that, but particularly from anthropology. And Anne Herring was a huge influence on me, as I think she was on a lot of younger and not so young anthropologists. But as a geographer, I was fascinating. And other people, other anthropologists who have said, this is how we should look at the world or look at the society. I'm fascinated by that, but I'm also informed by that. And I think that sort of underpins my work, is sort of trying to reconcile as best I can geography, history, anthropology, and then pop health research.
Right.
And I get kidded because, again, people will say, "Oh, you're an anthropologist." Sylvia, my colleague, Dr. Sylvia Avenue, says, "Oh, Paul's an anthropologist." And I'm going, "I'm not an anthropologist. I don't have the training, the formal training to be one. I'd love to be, but I'm not qualified." And other people have said, "Well, you're basically a historian." And I say, "Well, I'd love to be, but I'm not." It's sort
Right.
of trying to pull these threads together to make a meaningful narrative. And I see that in my research. That's how I'm trying to do it. And a lot of this, believe it or not, self-taught. Just as a graduate student, you go in, "Oh, okay, today I have to read about, virology, or I have to
Right.
read about, cross-cousin marriage, or I have to read, whatever you need to read about." And
Hmm.
you end up sort of building at least a rudimentary understanding of this. And I think there's that rudimentary understanding of anthropology. I do my best, and I listen to anthropologists so that I can understand better what's going on.
That's really interesting. And that really resonates with me too, as somebody who really likes interdisciplinary research, is that idea of following the research where it goes. And it might be going, it's interesting you talk about geography and talk about space, but I'm hearing you think about time a lot too, like
Mm-hmm.
its movement across landscapes and through time. And I think that's a really powerful look at health, that things that happened 200, 300 years ago are still affecting people today. And I think that kind of lesson is something that it sounds like you're the right Avenger to bring all that together to kind of give us some of that, which is really, really fascinating and really important, I think, to think about, that it's not always just a direct job or career interest in health, that it can be a broader interest bringing together lots of different subjects. But actually that leads into the last question I wanted to ask today, which is, what advice would you have for somebody that's interested into getting into questions of
Wow.
health geography or health histories in the way that you're working?
The first thing I would say is read widely,
Yeah.
and that means reading beyond your literature. And that, I think that was the key thing, was that I ended up reading a lot of books, a lot of articles, a lot of papers that were not geography, and I
Right.
learned a lot from it. I think the other thing is to ask questions of people, of scholars from other areas or of your own area. So if we're thinking of anthropologists here, young emerging anthropologists, to certainly ask questions of your profs and other faculty members. Don't hesitate to do that. But if something tweaks your mind, tweaks your interest, drop a line to a geographer, drop a line to a historian who's done work in an area that you're very interested in. Say, "Hi, I have this thought, or I want to pursue this direction. Can you give me advice?" And I benefited from that from many different people. And Anne Herring, I mentioned, Dr. Anne Herring, who's now retired, who was just fabulous.
Right.
I mentioned her earlier, but she was one of those people who was incredibly important for directing my research, particularly
Right.
after my PhD. Same thing for Dr. Q Young, who became my postdoctoral supervisor at the University of Manitoba. incredible, again, a very diverse man, a very accomplished man, who saw the health in a broad sense,
Right.
anthropological, medical, pop health, historical, you name it. And so ask those questions. Those people are there very often. They're there to sort of they're happy to answer
Yeah.
those questions. They're happy to facilitate. They're happy to mentor. And I think that's a word that we use occasionally, but we need to use it more, is mentor and mentee. But to mentor something to someone, to take that responsibility on of saying, I'm going to help you in the ways that you need to move forward, not because I see a benefit for me, but because I think it's returning what people did for me. People
Yeah.
mentored me at every stage of my career, and it's time for me, and has been time for me, to give back in that sense. So don't be afraid of sort of inserting yourself. Very often people want to talk about their research. I love talking about my research with someone who's actually interested in it.
Yeah.
We go to a conference and we give a talk, and your colleagues may be, okay, that's great, or whatever, or maybe they're excited or whatever. But if someone comes to you and says, oh, I have this question about what you did and
Yeah.
what you found, and you're often engaged in that, because then you can sort of spread the word a little bit. You can educate people in an informal setting, or what have you. And maybe that's your future student, or maybe that's your future collaborator down the road. But I would suggest to think beyond those disciplinary boxes.
Mhm.
Learn to ask different questions. And I think I do this with my first year classes. I ask them, because they're students from it's a service course, and we have 150, 170, 180 students there, of whom maybe 5 are geography students.
Oh.
So all these students from engineering or from history or from wherever. And how do you distill human geography down to a soundbite?
Right.
And the answer to me was that it's about asking questions about space and place. It's about asking questions that refer to the fundamentals of geography. And
Right.
you mentioned there's history, and history is about time. Geography is about place, space, and place has a very, very sophisticated meaning in geography. It's about your relationship, how you view your place. And if you think about your hometown and what makes it that great place or that terrible place to live, when you couldn't wait to get out of there, that's about geography.
Right.
It isn't the sole, it's not that geographers own that. Geographers don't own that, but that they think about that. Or in terms of spaces, what are the connections between two communities? And we talk about epidemics, as I talked about before. The connections between communities. What facilitates the spread of a virus between two communities? What links these two places in space? How does, let's say, having a jet aircraft, the jet age, change that space? Well, it changes the space-time fabric by collapsing it. It makes things closer, even though they're not physically closer, they're now closer in time. But that is what we think about. How are things closer in space now than they were 50 years ago? And how does that have an impact on the spread of disease? Or alternatively, as a health geographer, I might be interested in the location of medical care, hospitals.
Mm-hmm.
So what would happen if we put a hospital over here in the city? How would that change space, if you will, the space of treatment in a city? And the answer is, you can consider, you can ask those questions. But what I find is that you ask those questions because you anticipate those answers. So because of who I am and all the education I've had, I start asking those questions. Those questions are really kind of cool. And an anthropological student or a person such as yourself, who's come up through the ranks, is now a professional anthropologist and a health anthropologist, will ask slightly different questions. So if we ask our questions together, we get a much richer view of what was going on. And also perhaps we can play those questions off against each other.
Yeah.
Because if we're asking questions about space and place, but at the same time, we have to consider culture and communications and things like that, from an anthropological sense, they tend to answer each other a little bit. So it is about asking the kinds of questions we ask. Broaden your horizon as best you can in terms of that. Read widely, talk to people. Don't be afraid of actually sending off an email. I've done that many times. I've sent copies of my PhD dissertation to people back in the day when you actually had to send physical copy, and nowadays you just send a link or whatever. 550-page dissertation in the mail costs you a lot when you've just finished your PhD and you don't have a job. But it's a way of building those bridges. Read, look at things from different perspectives. I don't know. Those are the sorts of things I would suggest. But ask different questions is perhaps fundamental to the whole experience.
No, that's really interesting. And it's lovely to hear that you're championing teamwork in there, that there's different perspectives need to come together, that no one's an island. I really, really like that message as part of this. It's something that's really, it's actually resonating through many of the other interviews where we're hearing a lot about allied health partners, and we're hearing about allied health researchers and healthcare teams, and the idea that, it's one body we might be dealing with, but we're dealing with everybody's bodies in a sort of interrelated network. That's a really, really powerful message to hear that also works through time and space as well.
Yeah, the two biggest lessons I've learned since I did start my postdoc in 2000 were that it's health, not medicine.
Okay.
So we look at health, and medicine is part of that, and medical research is part of that, but it's health, and health is huge. And the collaborative research is where it's at. You leverage the strengths and the interests and the power, just the disciplinary knowledge of a bunch of different people working as a team on a project, and you get much better results than that sort of sole scholar in the archives kind of thing. And that's what I was when I did my PhD. I was, like many others, a person who spent a lot of time in an archive going, eureka, eureka, yeah. and writing a dissertation that became a book. But it was me on my own, and it was my kind of limited view of reality in the world of the past and what have you. And I found it so much more satisfying, so much better. The kind of research I do is so much more powerful, I think, since I have been working with other people, because I'm only one person, and I have one perspective on life and on my research, and other people bring so much to the table. So again, maybe that's another thing, is don't be afraid to work with other people. Yeah. Don't be afraid to bounce ideas off of other people. So maybe you're doing a term paper. Don't obviously write it with other people unless that's part of the, it's a group project. But don't worry about bouncing ideas off them. Yeah. Ask your friend or your partner or your parents or whatever, or even someone else that an acquaintance in the class, and say, what do you think about this? I'm looking at this. What's your thought on this? It doesn't have to be that sole exercise or that sole experience in terms of doing research. And as we move more up the food chain in terms of classes and your level in undergraduate and then into graduate school, you're more capable of doing that. You've developed those kinds of social connections, and you've developed that ability to ask those awkward, send those awkward emails. You go, oh, you don't know me, but I'm, I'm just fascinated by your work. You're better able to do that, to the point where I'm now at a stage where I don't feel, excuse me, this is Google. I'm at the point where I'm at a stage where, it could be a world-class researcher. I don't mind sending an email off and saying, okay, this is what I'm working on. What do you think? Would you like to work with me, or do you have any ideas or guidance for me? That's so amazing. Do not be afraid. Yeah.
I like that. Be brave and bold. I like that. That's a good takeaway message from this too. And so I want to thank you, Paul, so much for joining us today and sharing your experiences, your expertise on this. This has been really a fascinating conversation. I know we could just go on for hours, but I want to say thank you. And thank you also to our audience for tuning in. And I want to say see you all next time on another edition of Let's Talk About Health.